Here at sqadia.com, we have covered a wide range of topics related to human anatomy. We have also discussed many joints of the body and classification criteria for different joints to be categorized and distinguished. This lecture will answer the question, what is a synovial diarthrodial joint? A synovial joint is a movable joint comprised of a layer of fibrocartilage or hyaline cartilage that lines the opposing bony surfaces and lubricating synovial fluid in the synovial cavity. The answer to this question cannot be a simple definition that states what the synovial joint is. Instead, I will give a detailed answer to this question under these three headings. We will talk about the structure of a synovial joint, type of movements that take place at synovial joints, and classification of the synovial joints. So, let's dive in. The synovial or otherwise the diarthrodial joints are freely mobile and are considered the main functional joints of the body, if we look at its structure components here. Here you can see the two bones. Its joint cavity characterizes the synovial joint. The joint cavity contains synovial fluid secreted by the synovial membrane, synovium, which lines the articular capsule. The cavity is surrounded by the articular cartilage or capsule, which is a fibrous connective tissue that is attached to each participating bone just beyond its articulating surface. Additionally, the bones are separated by a layer of cartilage, which helps to absorb shock and reduce friction. This layer of cartilage, combined with the synovial fluid, allows the bones to move smoothly and easily against one another. Here, the W-shaped part is the synovial membrane that surrounds the joint cavity and articular cartilage. The articular cartilage and the synovial membrane are continuous. Within the joint cavity may also be present fibrocartilaginous structures like articular discs, menisci, and labra. We talked about how the synovial joints are the most freely moving joints of the body. The types of movement that they allow are gliding movement, in which one plane bony surface slides over another plane bony surface to a limited extent. Angular movement, which involves an increase or decrease in the angle between the bones taking part in the formation of the synovial joint. For example, flexion, extension, adduction, and abduction at the joint. The third type of movement is the rotatory movement. In rotatory movement, a bone moves around a longitudinal axis. Examples include medial and lateral rotation at the shoulder joint. If all these three movements take place simultaneously, then we say that circumduction is taking place at that particular joint. It is a combination of all three movements, such as flexion, abduction, extension, adduction, and rotation, if you are wondering how and where circumduction takes place. It occurs at the shoulder joint when one stretches their arm to relax. It also takes place at the hip joint, as well as the carpum to carpal joint of the thumb. So far, we have discussed the structure of synovial joints and the type of movements that take place at these joints. Now we will talk about the classification of synovial joints. Synovial joints are often further classified in three ways: according to the complexity of the joint, according to the degree of freedom of movement, and according to the shape of the articulating surfaces. If we look at the complexity of joint criteria, we see three types of joints here: simple, compound, and complex joints. The simple joint is the one where one concave bone articulates with the other convex bone. An example of this is the shoulder joint, in which the concave scapular part articulates with the convex head of the humerus. A concave surface is one that has a shallow depression in it, and a convex surface is one that is curved or rounded outwardly. Next is a compound joint. These are the joints that are formed by more than two bones articulating together. For example, the elbow joint, in which the humerus articulates with the ulna and radius. The bones are held together by ligaments and are often surrounded by a joint capsule. The third is the complex joint. This is the type of joint that contains an articular disc or menisci. For example, the knee joint. Complex joints typically have a combination of features from different types of joints, such as the combination of hinge and pivot joints found in the elbow. Now, according to the degree of freedom of movement, synovial joints can be uniaxial, biaxial, and multiaxial joints. The uniaxial synovial joints have only one degree of freedom, meaning that the movement is limited to rotation around the principal axis of the body. An example is the flexion and extension at an interphalangeal joint in the transverse axis. The biaxial joints possess 2 degrees of freedom, meaning movement can occur in 2 principal axes. The wrist joint is an excellent example of the biaxial joint. The wrist flexion and extension occur around the transverse axis, and the abduction and adduction occur about the anteroposterior axis. Lastly, the multiaxial joints have 3 degrees of freedom and permit movement in all 3 principal axes. An example of such a joint is the shoulder joint, where circumduction can occur. The last criteria for the classification of the synovial joint are according to the articular surface. There are 6 types recognized by the anatomist based on the articular surface: pivot joint, hinge joint, saddle joint, condyloid joint, ball and socket joint, and plane joint. These joints are named based on the shape of articular surfaces. Different areas of the human body contain each of these joints. Examples of these joints in the human body are: the atlantoaxial joint is a pivot joint. The elbow joint is a type of hinge joint. The carpo-metacarpal joints are a type of saddle joint. The metacarpophalangeal and wrist joints are an example of condyloid joints. Shoulder and hip joints are ball and socket joints. And lastly, plane joints can be found as intermetatarsal joints and the joints between the tarsal and carpal bones. As you can see, these synovial joints can be found throughout the body, from the joint in the neck to the joints between the tarsal of the foot. Now that we have discussed the 3 classification criteria of the synovial joints, we will briefly talk about the clinical conditions associated with these joints. The synovial joints allow a wide range of movement, thus they are also called the diarthrodial joints, meaning they are freely movable. However, this increased mobility also comes with a risk of injury. Synovial joints are particularly susceptible to wear and tear, and over time, the cartilage can begin to break down, leading to conditions such as osteoarthritis. This condition can cause significant pain and limit mobility and may ultimately require surgical intervention. It is important to maintain the health of synovial joints to prevent injury and ensure optimal function. This may include engaging in regular physical activity, such as stretching and strengthening exercises, and reducing repetitive movements that can contribute to wear and tear. Along with taking supplements for joint health is also recommended. Additionally, individuals may benefit from pain management strategies such as pain medications, physical therapy, and other treatments to reduce pain and improve mobility. So, To summarize the answer to the question, what is a synovial joint? A synovial joint is a type of joint in the body that allows for a wide range of motion and mobility. This type of joint is characterized by the presence of a fluid-filled cavity, called the joint or synovial cavity, which is surrounded by a soft tissue called the synovial membrane. One of the key benefits of synovial joints is their flexibility and mobility. They allow three types of movements: gliding, angular, and rotatory. This allows individuals to perform a wide range of movements, including reaching, twisting, bending, and other complex motions. These joints are further classified on the basis of their complexity, degree of freedom of movement, and shape of the articulating surfaces.
Watch our medical videos anytime and anywhere. Download sqadia.com app now.